screen and changing also. Please continue.
With pranams to God and thanks to my teachers, I beseech them to bless me always. I have no conflict of interest. Prime Minister Narendra Modi ji gave us lockdown and GST. Look at his hands are down. He was helpless. Then he told me, Deepak. So I told him, sir, I will also give something to my friends, and I'll make them unlock down, and I'll give them my GST, and my GST is great sex therapy. When you get married, wonders happened. But when you get diabetes, you wonder what happened. 80% of men struggle with erectile dysfunction in silence. They don't talk about it. When I Googled, I found 196 million web pages for Viagra and 53 million web pages for aspirin. Diabetes, friends, is a sexual health tsunami of our century. 40% of men above the age of 40 do have issues in the bedroom, and 62% of women admitted in a survey that they were not satisfied with their sex lives. Impotence has been the main cause of divorces in India. Is sex a secret? Who doesn't know what is sex? Every Tom, Dick, and every child even knows today what is a secret. So, but let us know what we should know, that sex is not a secret, but it is a sacred thing. And how do we physicians learn about the sexual dysfunction is by asking 4 questions to our patients. That do you have desire in having sex, or do you have desire, or no desire, or low desire? And then comes the arousal. Do you get erections? Do you don't get erections? Are you able to penetrate? Are you able to ejaculate? And same with the women. So erectile dysfunction, friends, is a focal point of men's health initiative today. And the basic issue of erectile dysfunction in India is that there is a rising trend. India has the largest population of males in the world, also has the largest number of men in the sexually active and reproductive age group. India has a rising prevalence also of the lifestyle diseases such as diabetes, cardiovascular disease, hypertension, which are the common risk factors for erectile dysfunction. And the sad thing is, erectile dysfunction remains underdiagnosed, with several men never coming to medical attention because of the sensitivity of the issues. There is definitely a rise in erectile dysfunction, especially in the younger age group. Men with metabolic syndrome have impaired endothelial dysfunction. We'll come to a little later what is endothelium and how does the endothelium get dysfunction. But remember, friends, every person who has a one or the other issue of metabolic syndrome has got endothelial dysfunction. And the prevalence of metabolic syndrome in men is always with organic erectile dysfunction. And the 4 types of patients, diabetic, obese, dyslipidemic, and hypertensive, are the deadly quadrant for patients having erectile dysfunction. Let me give you a newer perspective of it. What is the current perspective? That diabetes is an established risk factor for sexual dysfunction in men, as 3-fold increased risk of erectile dysfunction was documented in diabetic men compared to non-diabetic men. As among women, evidence regarding this is very less, but yes, there is definitely a higher prevalence of female sexual dysfunctions in diabetic women, and most commonly we see depression in them. When you look at the sexuality and diabetes, so why this happened is they have studied that erectile dysfunction occurs as one of the first problems, and along with that, there is also a decrease in the testosterone level. So diabetes definitely has a detrimental effect on the sexual functions of our patients. So diabetologists who primarily care for their patients should just not look for glycemic control, but also take help from urologists, psychologists, sexologists, and try to improve the quality of life by taking into the holistic aspect of it. Now, for many, it becomes a tragedy in their bedroom. This problem becomes a tragedy. So can we turn the tragedy into bliss? Yes, we can today. And what is the prevalence? Diabetes is more prevalent in India and China, and I call India the diabetes capital of the world. Erectile dysfunction is the commonest complication of diabetes. So India are the erectile dysfunction capital of the world. Our first huge data, 56,000 patients, all men diabetics had ED, premature ejaculation, and hypoactive sexual desire disorders. Women all had low desire, and depression was the most common thing which we saw. So we need to break all barriers. Patients don't come and tell us. We need to talk to our patients. We need to break the ice. We need to come out of clinical inertia and ask our patients that do you have problems in making love? Friends, if you ask this question to your patients who are 30 years and above and having a family history of metabolic syndrome, you will be surprised that these patients are waiting for you to initiate a dialogue on this. So the tip of a man is nothing but a tip of an iceberg. How and why this happens? Men with erectile dysfunction have been studied in European male aging studies as having higher risk of death. Erectile dysfunction, poor morning erections, and low libido had a higher mortality risk compared to men with no sexual symptoms. This has been studied. So it's a huge problem to the man and to the partner, and there is definitely a dent in the relationship between it. So this needs to it is nothing but emotional dysfunction. So the onus of sexual health of our patients lies with we physicians, and we are all going to live more. How are we going to spend the 60 plus gifted years? Are we going to spend in autonomy, dignity, gracefully age, or be sexually happy? Or do we want to be diseased, depressed, dependent, unhappy, or emotionally crippled? So we need to take care of our own selves and our own patients. So there's definitely a link between diabetes and sexual dysfunctions. Obesity, hypertension, sleep apnea, and depression are common conditions that occur along with diabetes. The time and energy spent on managing diabetes and related conditions can take a toll on emotional health. Changes in testosterone or estrogen because of diabetes, menopause, or co-occurring conditions can impact the libido, lubrication, and ability to become sexually aroused. Diabetes impacts blood flow, which could affect blood reaching the penis or vagina. For a man to achieve and sustain erection, he needs blood to flow in the penis. In women, decreased blood flow can play a role in vaginal dryness. High levels of glucose can also cause damage to the nerves, and the tip of the penis and clitoris are loaded with nerves. So these get affected and there is decreased sexual sensations. So let us understand what exactly happens. This is the vascular endothelium, and this is the corpora cavernosa smooth muscle cell. Normal endothelium produces endothelial nitric oxide synthetase, which diffuses the nitric oxide, which is the main chemical signaling molecule or the currency of the cell, which enters into the corpora cavernosa smooth muscle cell of the penis, converts GTP into cyclic GMP with the help of this enzyme gonadal cyclase. This cyclic GMP, through various mechanisms, relaxes the smooth muscle of the penile corpora cavernosa muscle cell and allows the blood to flow in, and the penis becomes erect. But sadly, this cyclic GMP hydrolyzes into 5-GMP with the help of an enzyme called phosphodiesterase 5. So what do we understand from this? We understand that for an erection, you need a normal endothelium, which produces normal endothelial nitric oxide synthetase and nitric oxide. Okay. So hence, anything which happens to a man like erectile dysfunction is nothing else but an endothelial dysfunction. So hyperglycemia in diabetes, increased advanced glycated end products, which we all know. There is definitely an oxidative stress. These alter the molecular things in the endothelium, like endothelial nitric oxide synthetase and nitric oxide. There are macromolecular damage, protein oxidation modification, endothelial gets apoptotic, and there is vascular endothelial signaling inhibition which happens. All these ultimately lead to cavernosal endothelial dysfunction, and there are functional alteration between the endothelium. So this results in erectile dysfunction. So definitely erectile and endothelial dysfunction in type 2 diabetes, there is definitely a link. It decreases the nitric oxide, it thickens the basement membrane of the capillaries. And when we look at the diabetic corpora cavernosa, because of glucose overload, advanced glycated end products increase ROS, they reduce the nitric oxide, and there is apoptosis. Simultaneously, we've also seen in diabetics reduction of testosterone, and through these mechanisms, there is corpora cavernosa smooth muscle cell dysfunction, and this leads to erectile failure in these patients. There are a lot of mechanisms which we know. Advanced glycated end products, increased levels of oxygen-free radicals, impaired nitric oxide synthesis, increased endothelin B, which is a vasoconstrictor, upregulation of Rho-A, Rho kinase, which produces generalized vasoconstriction in the penile and penile vasculature, neuropathic damage, and impaired cyclic GMP. During COVID, we found the coronavirus present in the corpora cavernosa. Friends, COVID is not a sexually transmitted disease, but definitely they've spotted this, and it had caused erectile dysfunction in the later stages. So SARS-2 receptor ACE enzyme 2 is expressed in the human pancreatic islet beta cells, and this was upregulated in during inflammatory stage like COVID. So COVID-19 and diabetes have a complex bidirectional relationship. So what we physicians need to know about erectile dysfunction today, we need to get educated our own selves to treat our patients. John Manlal gave a very beautiful algorithm. First, ask your patient, then legitimize the problem of erectile dysfunction. Tell them that these problems are very, very common in every diabetic, every hypertensive. So he doesn't feel that he's alone. And if you cannot go ahead, send them to or refer them to a good sexologist. Otherwise, open up a discussion and evaluate and work together and give a comprehensive treatment plan. Erectile dysfunction has got multiple causes: vascular, neurogenic, penile, trauma, hormonal imbalance, drug-induced, psychogenic. So many causes are there. But what I say is that what actually happens in erectile dysfunction is the nerves stimulate, vessels circulate, muscles facilitate, and hormones regulate. So if your nerves, vessels, muscles, and hormones are normal, your sex life is always rocking. Why should we be worried about erectile dysfunction? Is it something to be panicked about? Yes, because erectile dysfunction is nothing else but subclinical cardiovascular disease. And we know cardiovascular diseases are the global mortality, global cause of increased mortality across the world. And erectile dysfunction, friends, is the earliest marker of myocardial infarction because the penile arteries are the smallest, smaller than the coronary artery. Coronary arteries are bigger. So if atherosclerosis sets in the penile artery to 50%, these patients get erectile dysfunction. But the same amount of atherosclerosis doesn't occlude the other arteries, which are larger in diameter. And hence, ED appears much before than the coronary artery disease appeared. So you are only as old as your endothelium. My teacher, Paul Vanot, beautifully said this long time back. Let me give you a deeper perspective of all this. Today's concept is that penis can become a diagnostic tool of your endothelium health by asking a simple question about erections. And we know that hypertension, diabetes, smoking, raised lipids, homocysteine, estrogen deficiency all cause increase in the endothelial cell damage and vascular smooth muscle injury, leading to endothelial dysfunction. And once endothelial dysfunction happens, you see all these complications of apoptosis, like leukocyte addition, lipid deposition, vasoconstriction, vascular smooth muscle cell growth, and thrombosis. If you have a healthy endothelium, endothelium-derived nitric oxide is anti-thrombotic and anti-atherosclerotic. Endothelium dysfunction leads to lots of abnormal. And the pathogenesis of erectile dysfunction in metabolic syndrome is visceral obesity, genetic predisposition, increased food take, decreased activity, produces visceral obesity, also produces insulin resistance. Visceral obesity is proven to reduce the androgens, and insulin resistance lead to dyslipidemia and hyperglycemia, again leading to oxidative stress and leading to endothelial dysfunction. And once you have insulin resistance and obesity, there is definitely retention of sodium and increased sympathetic activity, also leading to hypertension and endothelial dysfunction. And androgens, friends, please understand, in diabetics are all less. Testosterone is less. So androgens are important for every function of the endothelium, especially maintaining of tunica albuginea, matrix, fibroelastic properties, and also the trabecular smooth muscle structure and functions, and also the nerve conduction. Everything is dependent on the. So when we look at our patients of heart disease, till the time they get any clinical disease or right from beginning of the risk factors, all these patients had erectile dysfunction as one of the common symptoms. So there is a wealth of compelling evidence to prove that ED is a risk factor for, and today we have metformin. There are 2-3 beautiful drugs in diabetes. One is metformin, another is alpha acarbose, and the third is SGLT2 inhibitors. These 3 drugs are so beautiful to treat our patients with diabetics and erectile dysfunction that they cover up all the causes of erectile dysfunction, vasculogenic causes. We know that acarbose is also improving the endothelial health, and metformin has also been studied to improve the endothelial health, and SGLT2 reduce the weight and reduce the hyperglycemia, reduce even other things in every diabetic which are causing harmful things. So these 3 drugs can be given to every diabetic, and these patients will start getting normal erections, because These three are taking care of all the causes of vasculogenic erectile dysfunction, and these patients don't need any PD5 inhibitors in their whole life. So how do we manage patients of erectile dysfunction? Rule out the organic and the psychogenic cause. If you rule out the psychogenic cause, which is the main component in every patient of erectile dysfunction, you ask one simple question that in last 8 days or 15 days, did you get up in the morning with an erection? If he says yes, he is absolutely normal. He does not have an organic ED. He is either psychogenic or situational erectile dysfunction. Please ask the couple to come together. Don't ask only the man or the woman to come together. They both should come together because solution always lies in the couple. And we treat. There are a lot of beautiful markers. Look at the gum of your patients. Chronic periodontal disease is a marker of erectile dysfunction. Salivary tumor necrosis factor, just take a swab from the gums and see it is indication of severe erectile. Low vitamin D has been associated with raised uric acid is again a predictor of erectile dysfunction. And that there is a relationship between platelet and lymphocyte. So just do a CBC of your patient and do total platelets and total lymphocyte. And if the ratio is more than 105, he does have mild erectile dysfunction. If it is 116, it is moderate. If it is more than 136, it's got severe erectile. So by just looking at a CBC, you can tell your patient that you are having erectile dysfunction, and you can then confront with him and he'll call you, Sai Baba, sir, how did you know about it? Neutrophil lymphocyte ratio, which he used to do in COVID, if it is more than 3, definitely he has got a severe erectile dysfunction. So how do we treat? We have 3 modalities: oral drugs, injection of papaverine, vacuum therapy, intraurethral drugs. These are the first 2. And if these fail, we send our patient to urologist for implants and the other anastomosis. But all these things do not work unless you counsel your patient and advise them on lifestyle measures. Friends, these 2 things are the mainstay of treatment of every sexual dysfunction. 2018 revision of process of care also mentioned that lifestyle changes should be the first line of treatment. We have 4 PD5 inhibitors, various onset of actions, various doses. Amongst them, tadalafil has the highest onset of action for 45 to 120 minutes, and its duration is 36 hours. So they all have side effects of headache, dizziness, visual disturbances, and the contraindications are nitrates and any cardiovascular event in the recent past, of course, anatomical penile defects, etc. We have treated patients for last 17 years, but they don't form the cutting edge solutions for the treatment of patients. We need to give them something more because they don't adhere to this. And PD5 inhibitors, if they are given for a long time, they are definitely beneficial as they increase the dilatation and increase the CGMP, which is responsible for relaxation of smooth muscle. They inhibit the smooth muscle contraction, etc. And beautiful studies have been shown that in diabetics, if you give 12 weeks treatment with low dose tadalafil, 5 mg or 10 mg, irrespective of whatever be the HbA1c, hypertension, prostatic hypertrophy or dyslipidemia, there is improvement in the sexual dysfunctions. My friend Dr. Jyoti, they put these patients on insulin pump, and there was a beautiful control of hyperglycemia, and he found improvement in sexual functions to the tune of 84 to 85%. Metformin, as we all know, SGLT2 inhibitors, we have already discussed. Buried penis syndrome is very common in diabetics. Give them 1 gram of metformin, apply sesame seed oil on the shaft of the penis and L-arginine gel. Beautiful result in 6 weeks you will find. Now we have glyceryl trinitrate also can be tried and has been studied, but there is less robust evidence in our country. But yes, in United States, they have tried, and this is very, very effective. We have newer therapies like low intensity extracorporeal shock therapy, platelet rich plasma, bariatric surgery improves the cavernosal neuronal vasorelaxation, and thus we have been treating erectile dysfunction, but none of these therapies reverse the pathophysiology of erection. So how do we look about? So many newer targets have been now come and still in the pipeline. So we need to have some more tools to improve or cure erectile dysfunction. And the role of regenerative medicine is very, very useful in this. Stem cell therapy in patients who are having stubborn erectile dysfunction, not responding to any medical line of treatment, and they didn't want to go for surgery. They were tried by human umbilical cord stem cells, and most of them improved in their sex life within 3 months. And so we have new phytonutraceuticals like L-arginine and fenugreek, which is very, very useful and very beneficial. Fenugreek, the mechanism is fenugreek in a saponized form have a structure of like similar to testosterone, hence are easily bound to globulin part of the testosterone, and So the free testosterone is released and the patient start getting good desire back. We have new drugs called Evanafil. The onset of action is 15 minutes, less side effects, and the half-life is just 5 hours. And this is the only PD5 inhibitors which can give it to patients who are on nitrates. All you got to do is skip the nitrates on that day, give him Avanafil, he can have good enough sex. This Avanafil will be washed out in his body after 5 hours. Next day again, he can start taking his nitrates as soon as. Beautiful study done on Evanafil, a double-blind study was done for diabetic, and they found that these patients in 360 minutes had 3 encounters. They could have sex 3 times, which is wonderful. So that's important. We have melanocortin receptor agonists. We have newer peripheral active agents like MAXK channel activator, guanylate cyclase activator, nitric oxide donor, and regenerative therapy, friends, has been shown to be a great promise in and low intensity shockwave therapy also. So let us see what is ethical perspective of the whole problem. We know that the risk factor of all risk factors is endothelial dysfunction. So we need to understand how do we restore endothelium. There are a lot of pharmacological remedies, ACE inhibitors, statins, insulin, L-arginine, tetrahydrobiotin, inhibitors of Rho kinase, and these pharmacological intervention can restore the endothelial function and improve all the things which are happening and the complications because of that. So we need to focus on these particular therapies. My teacher, Dr. R.D. Lele, long time published successful strategies for reversal of endothelial dysfunction. PPAR alpha gamma agonist, increased nitric oxide production, vitamin E, C supplement, L-arginine, tetrahydrobiotin, cypiaprin, SOD temple, statins, so many things which we have to give to our patients. We can reverse their endothelial dysfunction and give them a normal sex life for it. So, and my teacher, Dr. Paresh Dandona, my friend from Buffalo, he gave diabetics long-term testosterone therapy. And he found remission in diabetes. He also found insulin resistance improvement and also their sexual life increased because most of them were hypogonad. And Dean Ornish long time back proved that with intensive lifestyle changes, you can reverse the coronary artery disease. So we need to focus more on lifestyle and nutrition. Cleveland Clinic's original research said, though bypass surgery and angioplasty do exist, but nutritional intervention in their study not only halted, but even reverts the coronary artery. Huge plaque you can see has been opened up just by nutrition. So this is the most prompt, powerful, and persistent result which we can see. My new definition of erectile dysfunction, that it is diabetes type 5, which is with hypogonadism, prolonged hypoglycemia, and CV risk. Lifestyle measures have been studied to improve the pro-inflammatory milieu, insulin resistance, oxidative stress, and endothelial dysfunction. All these with healthy lifestyle can improve your well-being and wellness and also reduce the burden of sexual dysfunctions. 2 times Nobel Prize winner Dr. Linus Pauling declared that when he was receiving his second Nobel Prize, such a brilliant man, what did he say? He said nearly all disease can be traced to a nutritional deficiency. What else we want? We have brilliant people talking about nutrition, and this is possible for us to counsel our patients and improve their quality of life. So my take-home message is, take a detailed history. The secret of sexual fitness is love yourself. You are unique. And the blanket advice you can give to all your patients above 30s, try and avoid excess of salt, oil, and sugars. Give a U-turn out to your metabolic imbalance. Have a regular rhythm of sex life. Keep it happening regularly and increase your romance and touch to your partners. One of the biggest challenges in India is DOL. D is diabetes, H is hypertension, O is obesity, and L is lipid, which increase in us. So what do we do when the DOL is playing in a man's body? Well, the answer is simple. We do Bhangra. Now, what is Bhangra? Is behavior change, make them happy, stress-free, have an active lifestyle, do exercise, take care of your nutrition, control your hyperglycemia and all the risk reductions, and abstain from other substance of abuse. Counsel your patients on realistic expectations. Tell them at 70, 80, you can't be like 20 or 30. Increase your romance, which is, we have all PD5 inhibitors which are there, but they don't increase the desire. There are 40% patients who are not responding to it. So we give our patients testosterone, but we need to give it with caution. We can't give it to patients who are younger. They will develop azoospermia. We can't give it to older patients with morbid conditions. So what do we have? The Raja of all is L-arginine, fenugreek, lifestyle modification, and regenerative. This is the take-home message for every diabetic. If you give them this advice, friends, they will definitely improve in their sexual life. So be fearless, passionate, and focused even in the bedroom. So erectile dysfunction due to any cause can be managed today. It's not an option for anyone. It is how gracefully we handle the process and how lucky we are as the process handles us. So today we have so many things to give to our patient that this is a symptom which we can easily manage. And the ideal prescription for diabetic with ED should be counseling, lifestyle measures to be adopted. First thing, OHA or insulin, whatever you want to give. But if you give OHA, prefer metformin, SGLT2 inhibitors and acarbose. Statins, if he has got dyslipidemia. Antihypertensives, prefer ACE inhibitors and ARBs. If at all you want to give beta blockers, give them nebivolol. If at all you want to give diuretic, give intapamide. Low dose PD5 inhibitors if there are no contraindications. Low dose short course of testosterone if no contraindication. But monitor PSA, L-arginine supplement with fenugreek and zinc, nutritional intervention, and definitely mental health checkup. What a physician misses is he doesn't have time. He doesn't take a detailed history. He doesn't have the art of counseling. Educating the patient on realistic expectation is must, and you need to give an emphatic ear to your patients. Friends, this is triple ED. Erectile dysfunction is endothelial dysfunction and emotional dysfunction. Early diagnosis can prevent early death. Feminism, you need to love your partner. Your partner has given you a lots in your life. So you need to trust, adore, admire, and respect her. Unless we love each of us alone and each one of us, you need to love each other unconditionally, because love is a flow. It's creative. It's not sex what you want. It is why it flows, because and that gives you contentment. This contentment is much more deeper and valuable than contentment after sex. One who knows that contentment will never look for any substitute. Children who should be taught to love from infancy. The myth that teaching of love will lead the child to the world of sex is bullshit. This fear is groundless. The more love grows in a person, the more sex energy is transformed into sex. The less love-filled a person, there are lots of problems. So Voltaire beautifully said, be monogamous. Being monogamous is like a garden. Being polygamous is like a jungle. Both are beautiful. Now you have to decide what you want to be, a gardener or a jungli. But if you want to make your life beautiful and being monogamous and make your garden beautiful, you need to devote time. You need to cut the right type of trees, grass, put water, fertilizers, etc. So Voltaire beautifully said, try and cultivate your own garden. If you have patients of erectile dysfunction, don't send them to quacks. Send them to a good sexologist. So now you treat yourself, you can do it and see that he gets a good erection and this thing. This is my book, Sex Has No Expiry Date. My last slide. Friends, diabetes, the sexual health tsunami of our century, is very, very common and earliest marker of coronary artery disease. Low dose PD5 inhibitor statins can be ideal choice for diabetics. L-arginine supplement and fenugreek is a boon. Diabetes remission is a fact and not a myth anymore. Testosterone therapy with caution can improve erectile dysfunction and even insulin resistance. Erectile dysfunction, hence, is a correctile dysfunction. Detailed history, counseling, empathy, education are the key. So don't let your diabetics die in bits every day. If you do so, sex really has no expiry date. Thank you all for your love. I'll be happy to answer any questions you all have, and I'll be there a part in the